Hello, Dr. Joe here, medical doctor and a lifestyle medicine expert. Now, have you got resistant hypertension? Do you belong to the 65% club? Now, a couple of weeks ago, I did a video where I was talking about membership of this 65% club. These are individuals who have got what we describe as resistant hypertension. I coined the name 65% Club because 65% of individuals who are hypertensive belong to this very club. And by resistant hypertension, I'm referring to people who are using 3 or more blood pressure medications, and yet their blood pressure control is still not very good. So these are members of this 65% club. It is not an enviable club, but it is what it is. Now, in that very video, I also talked about the fact that there is a solution in sight. And that is what we're going to be talking about in today's video, okay? It's some good news and a little bit of bad news, if you like. Now, so the other thing to say here is that this is not a natural method of blood pressure control, what I'm about to talk about. Rather, it is a big pharma medication. It is a big pharma intervention. So let's look at the science. What Big Pharma did was they recruited 218 people, okay, 218 people with hypertension with a mean age of 60, okay? The average age for the 218 people was 60. And they gave them 2 milligrams of this new medication for 12 weeks, okay? And here's what I like about what they did. They carried out ambulatory blood pressure monitoring. I like that, okay? I'm going to talk more about ambulatory blood pressure monitoring in future videos because it is the way forward, I have to say. And let's look at their findings. Over the 12-week period, 70% of these 218 people had a systolic blood pressure reduction to less than 130, okay? So the upper value, which is the systolic blood pressure, it dropped to under 130. Now, what else did they find? They found that 76% of these people, of these 218 people, had a reduction in their aldosterone levels, okay? Nice reduction in their aldosterone levels. Now, I did say in that very video that I did before that one reason why these people belong to this club is because they have what we describe as primary hyperaldosteronism, okay? Because their aldosterone levels tend to be high. And in a recent video that I did, I talked about the fact that aldosterone is one of the saboteurs that is making your blood pressure control difficult. If you reduce the level of aldosterone hormone, then obviously your blood pressure is going to come down, okay? Make sense? So let's move on to the not so good news. Well, good news and not so good news. Now, the way the medication reduces your aldosterone level is because it blocks this enzyme, okay? It blocks the enzyme called aldosterone synthase. It's responsible for the manufacture of aldosterone. So here's the thing. If you have got primary hyperaldosteronism, which means your body is making too much aldosterone, that is secondary hypertension, okay? It is not essential hypertension or primary hypertension. And I've always said it that if you have got secondary hypertension, which is hypertension that is due to an organic cause, the treatment has to be directed at that very organic cause. That's the only way you are going to control your blood pressure, okay? Essential or primary hypertension is different. And that is what is happening here. Big Pharma is targeting the enzyme that is responsible for the overproduction of the aldosterone, blocking the enzyme that leads to the manufacture of aldosterone. So it's a very good approach for secondary hypertension. They're doing the right thing. Big Pharma, that is. Now, this presentation was carried out at the American Heart Association Scientific Conference. And this is the not so good news, and that's the fact that the medication is still awaiting FDA approval. Hopefully in the next 1 year it should be available. Now, what is the name of this medication? It is called Baxdrostat, okay? Baxdrostat. You heard it here first. Something for you to look forward to if you have got secondary hypertension that is due to primary hyperaldosteronism. Okay, so hopefully you got some value from this very video. If you did, please give the video a thumbs up, and please share this video with your friends, family and colleagues. Questions, comments down below. That's it for this video. Until next time, well, this is Dr. Joe signing out.